What is Singapore Premium Care Medical Concierge model, and most importantly, how does it benefit you? Do finish watching the entire video to be informed of your personal medical needs. Hi, my name is Jason and I'm the General Manager of Premium Care SG. And at Premium Care, we truly believe that your health matters. So let's get into today's topic. What does a medical concierge actually do, and how does Premium Care service you? What's interesting is that the term concierge is derived from the French term concierge, which means keeper of the candles. In medieval times, the concierge would light the way for guests coming to stay in the building and was always aware of the location and needs of each guest that was under his charter. Premium Care supports our clients in a similar way, only instead of navigating the hallways of a castle, we help guide our clients through the complicated hallways of the medical ecosystem. To know more about upcoming medical tips and sharing, please subscribe and hit the notification bell when we upload our weekly videos. Let me explain now how you fit into this wonderful web of private healthcare. There are 5 main stakeholders: specialist doctors, medical institutions, insurers, the government, and lastly you, the patient. The first stakeholder is the specialist doctors, hyper-focused on a specific area of treatment with years of experience honing their craft for a particular portion of the human body. They're not your average doctor, and Singapore has some of the best. Next, we have the medical institutions, such as hospitals or day surgery centers. I like to think of them as landlords that rent operating rooms to the doctors and nursing care to the patients. Similar to Airbnb, but with specialized equipment and far better cleaning services. The biggest stakeholder 是我们的阿公, otherwise known as the government. The Ministry of Health dictates regulations on the type of treatments that can be offered, the prices that can be charged, and thus the amounts that can be claimed through your CPF. The next stakeholder is the insurance companies. Household names like AIA or Great Eastern are part of a large family of insurers that sell us health policies which can be used to offset some of the costs involved with the healthcare. They each have their own rules, limits, and claim processing protocols depending on which policy you activate for your healthcare needs. Last, but certainly not least, we have you, the patient. The most important stakeholder in this ecosystem because your choice dictates your journey with each of these independent groups. So as you can see, the type of treatment you seek kicks off different combinations of interaction with each of these stakeholders. This can be pretty daunting because you don't know what you don't know. Questions like which doctor has a good track record for this specialty treatment, what's the estimated cost of treatment, how much of this is covered by my insurance or my MediSave, or even ones like are there no alternative treatments to the one that's been suggested. I mean, one that pops up a lot is actually, has all the documentation been submitted to the appropriate parties? I mean, that last one seems simple, but it's a huge time savings. How many of us right now know exactly how much health coverage they have, or know the exact terms of usage? So you see, there is complexity in the most basic of interactions with the medical ecosystem. Most of us use a real estate agent when buying property or a car agent when buying vehicles, even though we're probably smart enough to make these decisions for ourselves. The reason we do this is because we want assurance from someone with contextual knowledge, someone that can guide us through the decision-making process with additional information on the ground. So if we do so with material items, why not with our most valuable asset, our health? Premium Care's value add is that we are high-touch, low-volume. We're there for every consultation in person, which means we're there when you get admitted, when you get discharged. We basically observe the entire process, which helps us push for the changes that you may need. Because we keep every stakeholder on the same page at the same time, which is harder to do than you think because we're working with so many independent stakeholders. Anyone who's tried to renovate their HDB on their own will tell you how taxing it can be to work with independent contractors. But we have experience, over 10 years of doing this. And even then, we learn something new every day. But we're here to share that expertise with you. So to sum it up, as a medical concierge, we're essentially your personal consultant. We assist you in making the best medical decisions for your welfare, and we help ensure that your journey is as prescribed. Your physical and emotional well-being is always our top priority, as we walk the entire journey with you, every step of the way. In closing, to know more about upcoming medical tips and sharing, please subscribe and hit the notification bell when we upload our weekly videos. Premium Care, your health matters. 健康优先，幸福实现。